Welcome to the deep dive. If you've ever found yourself curious about, the really early stages of pregnancy, those first transformative weeks, or maybe you're actually going through it right now, well, you are definitely in the right place today. We're going to do a proper deep dive into a really fascinating, sometimes pretty surprising, and just fundamentally important time. What exactly is going on at just 8 weeks pregnant? We're looking at both the tiny developing life inside and, of course, what the expecting parent is experiencing. It's a time of really intense change, mostly behind the scenes, but it's laying all the groundwork.
It is quite remarkable, isn't it? What really gets me about this early period is just the sheer amount of foundational development happening. I mean, it's happening in such a short space of time. You've got this whole cascade of physiological changes in the parent kind of unfolding right alongside the most critical, rapid growth inside that tiny, tiny life. It's incredibly efficient, biologically speaking.
Absolutely. And that's our mission for this deep dive, really, to unpack all of that. We're using a fantastic, very detailed guide from BabyCenter as our main source today. It gives a really comprehensive look at what you can expect at this specific point. Our goal is to pull out the most important stuff, those surprising facts that make you go, huh, and the really practical advice. We want to help you, the listener, feel totally informed, but not overwhelmed by just tons of information. So let's jump right in. What is happening at 8 weeks?
Exactly. It's about kind of demystifying what can feel like a really internal, almost secret process, right?
Yeah.
And just giving some clarity and context to all those rapid changes.
Okay, so let's start with the tiny star of the show here. At 8 weeks pregnant, the scale of growth. It's just extraordinary. To give you a real sense of how small, but how incredibly mighty this little one is, our source says the embryo is about the size of a raspberry. A raspberry. I mean, we all know what that looks like. But the real wonder is what's happening inside that tiny package.
It really does help visualize the scale, doesn't it? And when you look at the actual measurements, it just highlights the microscopic but totally pivotal development. So at this stage, the embryo is about 0.62 inches long, head to bottom. That's the crown rump length doctors talk about. And it weighs, get this, just 0.71 ounces. Tiny. But those numbers represent this massive exponential leap in complexity compared to just a few weeks before. Think about it, from just a couple of cells at conception. The sheer number and type of cells now is just mind-boggling. It's like a quadrillion-fold increase, forming the basics of every single organ system.
That scale of growth from basically nothing to a raspberry-sized being that's starting to form complex systems, that's where it gets really fascinating. At just 8 weeks, so much is already being built inside. Let's talk limbs and digits. Our source says the baby's hands and feet, which started as little paddle shapes, are now actually sprouting distinct webbed fingers and toes. Imagine that. Little individual fingers and toes are starting to emerge, clearly defined, getting ready for the future.
And it's not just about how they look on the outside. What's really crucial is that deep inside those tiny limbs, cartilage models are forming fast. Those will eventually harden into bone. At the same time, tiny muscle fibers are starting to differentiate and connect to those forming bones, all guided by the nerve signals that are just starting up. This is literally the blueprint for all movement later on. And while that's happening, the internal systems are racing ahead too. The respiratory system, for instance. Primitive breathing tubes are already extending from the baby's throat, branching out toward the developing lungs. These are like little lung buds, starting that complex tree structure, the bronchial branching, that'll eventually form millions of air sacs for breathing way down the line. It's setting up the whole architecture.
The coordination needed for all that it's incredible. It makes you really appreciate how efficient early development is. And speaking of coordination, let's talk about the nerve network. Our source really emphasizes this. A huge, complex network of nerves is spreading super rapidly throughout the baby's whole body, but they're not just spreading out, they're actively making intricate connections with each other.
Which is absolutely vital.
Right, because they're also setting up communication lines with muscles, with other tissues, and maybe the most amazing part, with the developing senses like eyes and ears. This whole nerve network is basically the body's communication highway, right? Setting the foundation for every function, every feeling, every thought later on.
If we step back a bit, this stage really is the foundational blueprint for everything that comes next. The complexity of that nerve network forming right now, for example, is absolutely critical for everything from grabbing a toy later on to understanding language. It's the start of the central nervous system really running the show. And it's not just the deep internal stuff. We're also seeing the beginnings of the senses taking shape in amazing detail. The outer ear, for instance, is starting to look like, well, an ear. And at the same time, The internal parts, the bits needed for hearing and balance, they're developing too. And the eyes, they're not just forming, they're actually starting to get darker because new pigmented cells are being made. That's the groundwork for vision. The lens and retina are there, getting ready for light.
Wow. It's like the whole system is being meticulously wired up, piece by piece, getting ready for everything it needs to do. Now, one thing pretty much every expecting parent looks forward to is feeling that first little kick, that flutter, that definite sign of life inside. But at 8 weeks, even with all this incredible stuff happening, you won't feel anything yet. Our source is really clear. Your baby is moving, though.
Oh yeah.
These first movements, around 7 or 8 weeks, they're more like spontaneous twitches, little stretches, maybe tiny jerks as those new nerves connect to muscles. And you might not feel them, but they are visible on an ultrasound. Which is just an amazing thought, right? This tiny life is already practicing.
Exactly. And that waiting game for the first movements you can feel sometimes called quickening, that's a real part of early pregnancy. Our source confirms you typically won't feel your baby move until somewhere between 16 and 22 weeks. And the reason is simple, really. At 8 weeks, those movements just aren't strong enough. The baby isn't big enough for you to notice them through everything else. It's like trying to feel a tiny feather flutter from the other side of the room. It's just too subtle right now. It takes time for those movements to get stronger and more noticeable.
So it's definitely happening just sort of under the radar for you, which is a perfect reminder of how much profound development is going on beneath the surface. And just as a quick aside from our source, because pregnancy is, a whole big picture, if you're suddenly thinking, wait, could there be 2 raspberries in there? Well, BabyCenter does have specific info on being 8 weeks pregnant with twins. That's a whole different journey.
Definitely different considerations there.
Right. Or, on a much lighter note, they even touch on fun things like finding your baby's zodiac sign. Just shows the different ways people connect with the idea of this unique little person coming along. But the absolute key takeaway here is just how much incredibly detailed, foundational, and frankly astonishing development is packed into this super early window.
It genuinely is. It really speaks to the sheer efficiency and precision of human development. So much of the basic structure and initial function gets established in such a short time. It's creating the entire biological blueprint for a whole life.
Okay, so while all that microscopic magic is unfolding inside, your body, the expecting parent's body, is definitely not just chilling out. No, it's embarking on its own incredibly dynamic journey, and it's mostly being directed by this dramatic, sometimes pretty overwhelming shift in hormones. So let's talk about decoding your body. What are the common symptoms, and what are these big hormonal shifts you might be feeling at 8 weeks? It really is a hormonal roller coaster, and you're definitely strapped in.
That's spot on. Those surging pregnancy hormones, especially HCG, human chorionic gonadotropin, plus estrogen and progesterone, they're the main drivers behind almost every symptom you feel right now. It's like your whole system is being recalibrated for this huge job ahead.
Yeah.
Progesterone, for instance, is working super hard to thicken the uterine lining, but it also relaxes smooth muscles all over your body. And that has effects everywhere.
Right. And one symptom that sometimes causes a bit of worry, but is actually usually quite normal, is an increase in white discharge. It's called leukorrhea. Our source explains you might notice more white, kind of creamy vaginal discharge early on. And this is directly because of those higher estrogen levels boosting blood flow down there and stimulating the mucous membranes. The key thing is knowing what's normal. It can be clear to milky white, thin or thick, and it should smell mild or have no smell at all.
It's protective, really.
Exactly. It's your body's way of keeping things healthy, flushing out bacteria, and stopping infections from traveling up.
What's really, really crucial, though, is knowing how to tell the difference between that normal discharge and signs of a potential problem, like an infection. Our source gives some vital warning signs to look out for. If the discharge changes dramatically, like it turns green or yellow, gets a strong, fishy smell, or if you have persistent pain, itching, or burning down there, or if it just seems unusual in another way, maybe frothy or like cottage cheese, that's when you absolutely need to call your doctor or midwife. Making that distinction is so important for peace of mind and also for getting prompt treatment if needed, because some infections could pose a risk.
That's a really excellent and critical point. Okay, moving on to another very noticeable change, one that often triggers a trip for new bras, growing breasts. Our source explains that those rising hormones we mentioned, they're actively getting your breasts ready for making milk later on. Progesterone especially stimulates the growth of milk glands and ducts. So yeah, don't be shocked if you suddenly go up a cup size or even 2, particularly if it's your first pregnancy. Your mammary glands are starting their prep work.
And it's not just size. There are other visible changes, too. You might start seeing more noticeable blue veins on your breasts. because the blood flow increases so much to support all this growth. Your nipples might look darker and bigger too, and those little bumps on the areolas, they're called Montgomery's tubercles, they can become more obvious.
Yo, yeah.
Those things.
Yeah, and they're not just random bumps. They actually produce an oily substance that helps lubricate and protect the nipples, getting them ready for breastfeeding. It's all part of this natural, purposeful adaptation. The breast tissue is changing for its new role.
It's all part of the body's amazing preparation system. Okay, let's talk about something many people can relate to, pregnant or not.
Mm-hmm.
Abdominal bloating. Our source says this familiar, often uncomfortable feeling is down to those early pregnancy hormonal changes. It can feel a lot like pre-period bloating for some people.
Mostly progesterone again. Right, it slows down digestion. Which sounds bad, but it's actually so your body can absorb more nutrients for you and the baby. But the side effect is why your pants, especially around the waist, might suddenly feel tighter, even though your uterus is still pretty small and tucked away. You don't have a real bump yet.
It's the slower gut and maybe some extra gas, not the baby size, making things feel snug. And that often leads into two symptoms that are really closely linked and can be, well, pretty rough. A heightened sense of smell and food aversions. Our source describes it like suddenly having a superhuman sense of smell.
Oh, I've heard about this.
Yeah, you might walk into a room and that smell of coffee that you used to love, or maybe garlic cooking, suddenly becomes completely overwhelming, even nauseating. And unfortunately for a lot of people, this super sniffer ability means that most smells can trigger intense nausea, sometimes actual vomiting. Both this incredibly sensitive nose and developing strong food aversions where foods you liked before suddenly seem totally repulsive.
Hmm.
They're directly linked to those surging hormones, especially HCG and estrogen.
Ugh, that sounds miserable.
It can be, but the good news, and the source makes sure to mention this, is that both of these usually tend to ease up quite a bit by the time you hit the second trimester. So there's often relief on the horizon.
Thank goodness for that. Okay, and then there's the stuff happening when you're asleep. Weird pregnancy dreams. Our source paints up a pretty vivid picture, and honestly, it matches what a lot of people report. Like, 1 minute you're dreaming you gave birth to your partner.
Suckles, heard that one before.
The next, you're making a high-speed getaway in a school bus, or maybe a giant tidal wave is coming. Pregnancy dreams are famously bizarre, super vivid, and just, well, weird. Like, your brain's on a surreal movie binge all night.
What's really interesting about these dreams is how they often tie in to what's going on emotionally and physically. Yeah. They can reflect the huge excitement you're feeling, but also, naturally, the fears and worries and anxieties that come with the massive life change of becoming a parent. Hormonal shifts can mess with your sleep cycles, especially REM sleep, where most dreaming happens. Plus, increased blood flow to the brain might make them more intense. It's basically your mind working through this huge transition, grappling with the unknown even while you're asleep. Don't feel like you have to analyze every weird detail. Sometimes it's just your brain processing.
Right. It's your brain just trying to make sense of this massive shift, consciously and subconsciously. Okay, and then unfortunately, headaches. Our source highlights that headaches are pretty common in pregnancy. Factors like increased blood flow, your blood volume is expanding really fast, and just general fatigue can contribute. And a really practical point they make. If you've recently cut back on caffeine, which lots of people do in pregnancy, that withdrawal itself can trigger headaches as your body adjusts.
Yeah, caffeine headaches are real.
They can feel like a dull ache or sometimes more intense pain.
This brings up a really important question, though. How do you know it's just a common pregnancy symptom versus something that needs medical attention? Especially when it comes to pain relief. For headaches, the guidance on medication is crucial. Our source stresses. You absolutely have to ask your doctor or midwife before taking any pain medicine. Generally, acetaminophen, like Tylenol, is considered safe if you take it as directed. But, and this is critical, aspirin, ibuprofen, like Advil or Motrin, and most prescription migraine drugs are not considered safe during pregnancy. There are potential risks to the baby. That distinction is vital.
That is such important info. Don't just reach for whatever is usually in your cabinet. And besides medicine, our source also suggests some natural ways to try and ease headache discomfort. Things like getting a gentle massage, using a compress, maybe a warm one on your neck or a cool one on your forehead, whatever feels better. Also practicing relaxation techniques like deep breathing or meditation, maybe some gentle exercise if you feel up to it and your provider says, okay. Even just taking a warm shower.
Sometimes those simple things really help.
Yeah, sometimes those non-drug approaches can make a surprising difference in just easing that tension.
Exactly. It's about finding what works for you while always prioritizing safety. Now, while nausea and vomiting are super common, The source notes most pregnant people feel nauseated at some point, and about half actually vomit. There's a much more severe condition. It's called hyperemesis gravidarum, or HG. This is an extreme form of morning sickness, and it affects about 3% of expecting parents. So, much less common, but much more serious.
That's a really stark difference, isn't it? HG isn't just feeling a bit sick or throwing up occasionally. Our source explains HG involves severe, relentless nausea and vomiting. It can lead to really serious problems like getting dangerously dehydrated, losing a significant amount of weight quickly, often more than 5 pounds, and electrolyte imbalances if it's not managed properly. This is where it's absolutely crucial to know when you need to call your provider right away.
Absolutely critical.
They give a clear, vital list of warning signs that mean you need to contact your healthcare team immediately. No waiting.
Yes. You need to call if you find you absolutely cannot keep anything down, and that importantly includes fluids. If you start vomiting blood, which might look like coffee grounds, if you lose more than 5 pounds rapidly, if you feel really weak, faint, or dizzy, those are big signs of dehydration. Also, if you develop a fever or have severe abdominal pain, or if your urine becomes very dark and strong smelling, another clear sign you're dehydrated. These are all red flags indicating your symptoms might be severe enough to need medical help right away, like getting IV fluids or prescription anti-nausea meds to prevent serious issues for you and the baby.
Wow. It really sounds like understanding all these symptoms, even the weird dreams, and knowing that crucial difference between what's normal pregnancy stuff and what's a serious warning sign is absolutely key. It helps you feel more in control of this whole intense process and empowers you to know when to ask for the right support. All right, so we've talked a lot about the incredible stuff happening inside the baby and that whole whirlwind of symptoms you might be feeling. Now, let's shift gears a bit to the practical side. How do you actually navigate this journey? Let's look at a proactive checklist and focus on really vital self-care because it's not just about what's happening to you, right? It's also about how you can actively support yourself and your own well-being through it all, day by day.
Exactly. And these checklist items, they're not just, things to do. They are genuinely vital self-care strategies. They contribute to your overall health and well-being during this huge transformation, and they set a really positive foundation for the months ahead. They help you be an active participant in your own pregnancy journey.
Totally. Okay, so one really fun and kind of cool way to document this unique time is to start taking pictures of your bump. Our source really encourages creating a fun time lapse of your pregnancy by taking photos of your growing belly every week or so. They even give tips on how to get the best shots consistently, like standing in the same spot, wearing similar clothes that show your shape, using the same lighting. And here's the key part. Even if you don't really see a bump yet at 8 weeks, which, let's be real, is totally normal for most people, starting now is great.
Yeah, skip that baseline.
Exactly. It gives you that starting point for comparison later on. Trust me, you'll be so glad you have those early, subtle shots. When your bump is really obvious, it's a beautiful way to see the growth.
Beyond the fun stuff like photos, a really, really critical aspect of self-care, now and throughout pregnancy, is paying close attention to your mental health. Our source acknowledges that, yeah, feeling moody is common. You got massive hormone shifts, plus the sheer scale of the life change you're going through. But, and this is crucial guidance, if you're feeling more than just a little blue, or if those down feelings stick around for more than 2 weeks, if they feel overwhelming or start interfering with your daily life, then it's strongly recommended you maybe take a prenatal depression screening quiz and definitely talk about how you're feeling with your doctor or midwife. This proactive approach makes sure your emotional well-being gets just as much priority as your physical health. Perinatal mood disorders are real, they're common, and importantly, they're treatable.
That is such important advice, and yeah, often overlooked. It's so easy to just brush off feeling down as, oh, it's just pregnancy hormones, but sometimes it's more than that. Knowing the difference is empowering. And speaking of well-being, let's talk sleep. Or more accurately, maybe the lack of sleep. Our source really emphasizes focusing on getting good pregnancy sleep. In early pregnancy, you might find yourself feeling more exhausted than you ever thought possible, like bone-deep tired.
It's profound fatigue.
Right. And that crushing fatigue isn't you being lazy. It takes a huge amount of energy to build a human. Your body is basically running a metabolic marathon 24/7, especially for all that cell division and organ building.
Yeah, and this massive energy need often runs smack into various things that disrupt sleep in early pregnancy. Our source lists quite a few common culprits. Having to pee constantly because your blood volume is up and your kidneys are working harder, that relentless nausea we talked about, uncomfortable heartburn, annoying leg cramps, even starting to snore or snoring more can all mess with your rest. So, to help fight back, They offer some really practical sleep hygiene tips. These are designed to make your sleep environment and routine work better for you. Simple things, but they can be really effective. Like just going to bed earlier, sometimes more hours, is the simplest fix. Being mindful of what and when you eat, especially avoiding big, spicy, or acidic meals right before bed to cut down on heartburn, and using the right pillows. That can make a huge difference. Maybe a wedge pillow to prop your head up, or one of those big pregnancy body pillows for support.
Oh, yeah, those pillows are lifesavers for some people. And it's more than just pillows, right? Our source also suggests learning relaxation techniques. Could be using guided meditation apps, doing some gentle stretching, or deep breathing exercises just to calm your system down before bed. They also recommend sticking to a regular sleep schedule, even on weekends, to help regulate your body clock. Establishing a calming bedtime routine, maybe a warm bath, reading a book, not scrolling on your phone, something to signal it's time to wind down,
Oh, yeah.
and really making your bedroom dark and quiet. Think blackout curtains, eye masks, earplugs if you need them.
Creating that sanctuary.
Exactly. Creating the best possible environment for restorative sleep, which your body desperately needs when it's working this hard.
Okay, another self-care item that's sometimes overlooked but really important, especially in pregnancy, is using sunscreen diligently. Now, sunscreen is always important for skin health, obviously. But during pregnancy, it plays an extra role in helping you avoid something called melasma, or sometimes cloasma. This is when you get darker patches of skin, often on your face, but sometimes elsewhere, and it's often triggered by those very hormonal changes we keep mentioning. High estrogen and progesterone can stimulate your body to make more melanin, the pigment that colors skin.
Ah, yes, the famous mask of pregnancy. I've heard of that. Our source describes melasma sometimes showing up in that mask-like pattern, maybe around your upper lip, nose, cheekbones, forehead, sometimes on the neck or arms, too. It's apparently more common if you have a darker skin tone naturally, but really, it can affect anyone who's pregnant. And while it can be upsetting to see those patches appear, the good news is they usually fade completely after the baby arrives, or at least get much lighter.
But prevention is definitely better if possible.
Right, and prevention is key. Our source strongly advises staying out of direct sun as much as you can, and this is the important bit, consistently using a broad-spectrum sunscreen with an SPF of 30 or higher every single day. Rain or shine, indoors or out.
Even incidental exposure matters.
Exactly, because UV light is a major trigger. Consistent sunscreen use is the best way to try and prevent melasma from showing up or getting worse.
That's a really critical preventative step. Okay, lastly on our checklist, it's helpful to learn a bit about pregnancy weight gain. Our source explains that how much weight you should gain is really individual. It depends mostly on your weight before you got pregnant, your body mass index, or BMI, and also if you're carrying twins or more. For someone starting at a healthy weight, the general guideline is to aim for maybe 1 to 5 pounds total in the whole first trimester, and then about 1 pound per week after that. There are also pregnancy weight gain calculators online you can use. They can help you figure out a personalized target range, which can be a useful tool just to track things and make sure you're gaining healthily.
Right, it's not about eating for two quantity, it's more like eating smartly for two.
Precisely. Focusing on nutrient-dense foods.
So, what does this all really mean for your daily life at 8 weeks? It's clear it's not just about passively experiencing what's happening inside. It's also about how you can proactively support yourself through it all, setting yourself up for the healthiest, most comfortable pregnancy you can have. These practical steps really put you in the driver's seat of your own well-being. Okay, let's shift focus now to what people might see, or maybe more accurately, what they don't see yet from the outside. At 8 weeks, a lot of expecting parents are kind of anxiously checking the mirror, waiting for that first hint of a baby bump, maybe dreaming about maternity clothes. But when it comes to that elusive bump, our source gives us a pretty honest reality check. For most people, 8 weeks is still way too early to have a real, noticeable pregnancy bump. Your uterus is only just starting to grow bigger than your pelvis.
That's such a common misconception, isn't it? People expect to show really early sometimes. But while you probably don't have that classic rounded pregnancy bump at 8 weeks, our source does point out that it might already be getting trickier to hide the subtle changes that are happening. Like we said, your clothes might feel tighter because of hormonal bloating or slow digestion. Your chest might be noticeably bigger from breast growth and more blood flow. You might just feel sort of generally softer or puffier around your middle rather than having a distinct curve yet.
Exactly. And if you're not quite ready to share your big news with everyone, maybe you're waiting until after the first trimester, which is super common. That can create a bit of a wardrobe puzzle. Our source has some practical, low-key advice for anyone trying to keep things under wraps for now. You might need to get a little creative with looser clothing that kind of skins over your chest and belly.
Strategic dressing.
Totally. Think oversized cardigans, flowy button-down shirts you wear untucked, maybe comfy sweatshirts over leggings. Stuff like that can work wonders for now, keeping your secret safe a bit longer without drawing attention right to your middle.
And beyond just hiding a non-existent bump, our source gives a really candid, honest description of what they call the first trimester look.
Ah.
Let's be real. The first trimester often isn't your most radiant phase.
Lasting, definitely not always glowing.
Right. Thanks to that pervasive fatigue we mentioned, and maybe constant nausea, you might find you've got stubborn dark circles under your eyes looking tired all the time. Your skin might even look a bit pale, or, as the source puts it rather vividly, maybe even have a slight greenish tint. Really gives meaning to looking green around the gills.
Oh dear.
It's often not the glowing image people have in mind, and it can be a bit of a shock psychologically. You might look in the mirror and think, who is that tired, slightly green person?
That's such a relatable description, though. It's definitely not what you see on magazine covers, is it? But, and this is important, fear not, because our source offers a really hopeful outlook, the anticipation of the famous second trimester glow. They reassure listeners that this less than glamorous phase usually doesn't last forever. Your body starts to adjust, hormones often stabilize a bit, and for many people, energy levels bounce back.
That's a key message of hope, really. Many expecting parents really look forward to the second trimester because it's quite common to start feeling, and often looking, pretty amazing. That period is often marked by the arrival of a more defined, beautiful baby bump. Often your hair might seem thicker and shinier because hormonal shifts can slow down shedding. And you might actually get that glowing skin people talk about, partly thanks to increased blood volume giving you better circulation. It's often called the honeymoon phase of pregnancy, where the early discomforts tend to lessen and the more joyful physical signs start to shine through.
Sounds like a well-earned reward after those first few tough weeks, almost like emerging from a chrysalis or something. But it's also really important to remember, and our source is careful to say this, pregnancy affects women differently.
Crucial point.
Yeah. What one person experiences as this amazing glow, someone else might just feel subtly better or honestly might still face challenges. So it's about managing expectations with some self-compassion while still holding on to the general hope of feeling better soon. And just to give a sense of the bigger picture, the BabyCenter page itself links out to tons of related topics, things like working while pregnant, how to handle a second pregnancy with a toddler already around, more detail on those breast changes we talked about.
It's a whole ecosystem of information.
Right. It just underscores that this 8-week mark, while significant, is just one step in a much larger, really complex, and deeply personal journey.
What's really interesting here, I think, is the psychological side of these physical changes, even the really subtle ones early on. It brings up an important question about managing our expectations versus the reality of early pregnancy. Understanding that, hey, not everyone gets an obvious bump right away, or that there's a very real first trimester look that often comes before any glow that can actually help. It can reduce self-consciousness, maybe stop us comparing ourselves to others quite so much, and just promote a more realistic, accepting view of this incredibly unique process. It's about embracing each stage for what it is.
It definitely helps to know you're not alone in whatever you're experiencing, right? That your own unique path is part of this bigger shared human experience. Hashtag Chag outro. And just like that, we've really covered a lot in this deep dive into the truly fascinating, intricate world of being 8 weeks pregnant. We explored that incredible, almost unbelievable fetal development from that tiny raspberry size starting to form distinct limbs, that vast nerve network spreading out, to those first little movements that you can't feel yet but are happening, hinting at the future. We also decoded those common yet often really challenging symptoms for the parent, all driven by those powerful hormones.
Yeah, a lot going on.
Right, from the normal increase in discharge and the changes happening in your breast to that sometimes overwhelming sense of smell and those really wild pregnancy dreams.
It's so clear that this early stage, even though it's often hidden from the outside world, is just a powerhouse of activity and transformation. The goal of this deep dive, really, was to give you valuable, digestible information, things that are deeply insightful, hopefully allowing you to feel more empowered and informed about this huge journey you might be on or thinking about. It's a time of massive internal change for both parent and baby, often paired with significant external symptoms that kind of constantly remind you of the extraordinary biological work that's underway.
Absolutely. So whether you're currently expecting, maybe planning to be, or perhaps you're just curious about the wonders of human development and, frankly, resilience, this deep dive has definitely shown us just how much intricate magic and intense transformation happens in such an incredibly early stage of life. It's really a testament to those quiet, powerful beginnings unfolding inside.
Which raises, I think, an important final question for you, the listener, to maybe reflect on. How do we best honor and support this incredible, complex journey of pregnancy when so much of it, especially in these early weeks, is initially unseen? When it's so deeply personal and often marked by challenges that are invisible to everyone else, it's this profound duality, isn't it?
Hmm.
Internal development and external adaptation, unique for every single person, yet universally astounding when you think about it.
That's definitely something to ponder as you continue on your own journey, whatever that might look like. Thank you so much for joining us on the deep dive. We'll catch you next time.